Chronic fatigue syndrome is an illness which is consist of cluster of symptoms, and it is associated with the emotions, thinking of the person. So there is a link between the brain and the function of the brain and the body, because the symptoms are, somatic symptoms, pain, shortness of breath, bowel problems, combined with symptoms which are coming from the brain, which are change in emotion, change in memory, and there is a link between the mind and the body. We know that the mind and the body are connected through different pathways, through hormones, through the immune system, and through the nerves themselves. As I said earlier, the symptoms are a cluster of symptoms coming from different parts of the body. The main one is feeling tired for no reason. Usually we will feel tired when we do some exertion. So we will do some activities which are hard. In this illness, the fatigue cannot be explained by the effort we are doing. Sometimes it can follow an effort, and sometimes it just comes by itself. And even if it will follow an effort, it will continue for a long time that cannot be explained by the effort or the activity which we already did. The second symptoms is pain. You will have pain around your joints, the end of the muscle, soaring muscle. And then there is usually headache, and the headache is a special type of headache which is around the head, and it is like heaviness. And the fatigue, not just in your muscle, and tiredness not just in your muscle, but it is also involving your brain function. So when you try to concentrate, when you try to put a mental effort, you feel tired, you cannot focus, you will lose your concentration easily. Again, it cannot be explained by the task or the efforts. It sometimes comes with not much task. Also, there is gastrointestinal symptom with stomach trouble, diarrhea, something resembling irritable bowel syndrome. And some people will have some sensitivity to sensory stimuli coming from the environment. They cannot tolerate bright light. They cannot tolerate excessive voices or noises around them. They are more sensitive to light, sound, vibration, taste, and other. Also, there is something related to the nerves, certain type of the nerves, we call them the autonomic nervous system, with some maybe intolerance to heat and some changes in the feeling of temperature in your body. And there are, people who are suffering from this illness also saying that they have flu-like symptoms, sore throats, tender lymph nodes, very much similar to the flu symptoms. Because we are talking about the symptoms of this illness, they can come all together, and sometimes they can come in different combinations. So not everyone have all these symptoms. Well, this is a very important question, because there is something called differential diagnosis. This illness can come, with a long list with differential diagnosis. What I mean by that illness is associated or maybe the cause of these symptoms. They start from the viral infection and will end in endocrine diseases and immune diseases. So one should be very careful in doing all the assessment perfectly and all the investigation perfectly to try to find the cause. One of the most important cause for this illness is depression. We have high percentage of patients with chronic fatigue syndrome. Actually, all of them, they have some emotional changes. They either suffer from numbness, they have no much feelings, and anxiety, and depression. And the association between those mental health problems and chronic fatigue syndrome is so strong that the antidepressant is one of the most important options in the treatment. And not just, treating these emotional changes with medication is the only option. We should understand from where the depression is coming, what kind of stresses the patient has in his life, and how we can treat all these stresses. Actually, we should also be very careful in assessing all the psychiatric symptoms, not just the depression. For example, sleep disturbance. Sleep disturbance is very important. And if we will not be able, sleep disturbance can be part of the chronic fatigue syndrome and can be part of the depression. If we wouldn't be able to treat the sleep disturbance, it might be difficult to treat the chronic fatigue syndrome. So the mental state in total and the psychiatric symptoms, all of them, and especially the emotional changes, and on the top of the list is depression, are very important element to be treated if we would like to be successful in treating patient with a chronic fatigue syndrome. And this is why psychiatrists are involved in the treatment, assessment, treatment, and management of this illness. We have, as I said earlier, the option of medication, psychotropic medication. I'm talking about psychotropic medication. I'm not talking about other medication that can be used to treat physical health problems associated with this illness. I'm talking about the psychiatric medication. Second, psychological help, psychological therapies. 3, occupational health intervention for social intervention. Mostly regarding the medication, we use, as I said earlier, antidepressant, and sometimes we use things to treat, other medication to treat an anxiety and to treat sleep disturbance. So antidepressant, medication to treat sleep disturbance, and anti-anxiety medication are the ones which we are using with chronic fatigue syndrome. Regarding the psychotherapy, there is specialized type of CBT, cognitive behavioral therapy, specialized for this group of patients. It should be done by a psychologist who has some expertise in providing this specific type of CBT. The occupational therapists are very important as well. They will look into the symptoms and how much these symptoms are impairing the function, because at the end of the day, all the treatment in medicine or psychiatry, we are aiming to improve function. So they will look into what are the impairment in function, how much the patient is responding to this symptom, what are the limitations these symptoms are creating, and they will put a plan to encourage patient slowly, step by step, in certain ways, to do more, to be able to cope with their symptoms. Social intervention may be a wide term, but this might be needed. But simply giving advices about what type of life the patient, should try to, persuade, because social factor usually is the nest for stresses in our life. So we need also to look into what kind of social factor which are contributing to the illness, and simply sometimes just discussing them and putting them on the table is beneficial, because then we have another, point of view about our life and how we can change things around us. Always, we should have a trust and beliefs in our patients, and they will, and we should always work for, for full recovery. This is the ultimate aim in psychiatry and medicine. Full cure with hope, with encouragement. This is the most important thing. How much you can translate this concept of full cure into practice, it will depend on the cooperation between the patient and the physician. So we have the knowledge, we have the treatments available, and then if we can work together, we can do something. So the most important factor to answer your question is how much we can bring all these treatment to the patient, and how much you can bring the patient, our patient, to this treatment. And then, with good faith, with good hope, with good, believe in our ability, I think there is always a chance for full cure. Now, to answer your question in scientific way, yes, there is a record that patient can get fully recovered from chronic fatigue syndrome. However, the course of the illness might be a kind of chronic course, which means that it will take some time. And the name of the illness itself, point to this fact. So it might take longer, but we know people recover fully.